If you or someone you love is over the age of 65, you likely know that navigating the healthcare system requires a high level of awareness. The next time you check into a hospital, you will likely be handed a clipboard and asked to sign routine forms. Most of us sign them without a second thought. But today, I have one important request. Do not sign anything until you finish watching this video. Across the United States, hospitals are navigating complex systems that can occasionally turn an ordinary admission into a significant financial challenge. Many people unknowingly find themselves facing unexpected out-of-pocket costs or obstacles when they need rehabilitation services the most. My goal today is to break down 5 dangerous hospital traps that seniors encounter far too often. More importantly, I will provide you with the exact language you need to protect your hard-earned savings and ensure your recovery is prioritized. In my work with adults over 60, I see this pattern repeating itself. It is important to clarify that this isn't about individual doctors, most of whom are dedicated professionals, but rather about a system that is often structured in ways that can be overwhelming for patients. These traps are real. They happen every single day across the country, and the people affected are usually not careless. They are simply people who were not given the chance to ask the right questions. By the end of this video, you will have a clear, actionable plan to protect yourself. Let's start with the trap that seems to surprise people the most. Imagine this. You have done your research, you've called your Medicare Advantage plan, and you have confirmed that the hospital is in-network. You feel confident. But 3 weeks later, an envelope arrives in your mailbox with a bill for $1,400 from a doctor you have never even heard of.
Here is why this happens. While the hospital itself is in-network, the specialists working inside, such as the anesthesiologist who assisted during your procedure, the radiologist who read your scan, or the ER physician who saw you at intake, often operate as independent contractors. Because these specific doctors may not have a network agreement with your insurance, the bill becomes your responsibility. However, there is a federal law called the No Surprises Act, specifically designed to protect patients from this exact situation. Very few people use it because they don't know they have the right to ask. The moment you arrive at the hospital, before any procedure or specialist consultation, tell the staff, "I only consent to treatment by in-network providers under the No Surprises Act." Writing this down and keeping it with you puts the hospital on legal notice. If they bring in an out-of-network specialist after you have given this instruction, the financial responsibility shifts back to them, not you. Now, let's discuss what happens when you are preparing to leave. Hospitals are under significant financial pressure to move patients out of beds as quickly as possible. Sometimes, this can lead to a discharge occurring before you or your loved ones feel you are physically ready. A doctor might come in and say, "You are doing well enough to go home." Because this is a medical professional speaking, most people simply nod, get dressed, and leave. But 3 days later, if you struggle to move around safely or your recovery stalls, you may end up back in the emergency room, which is often much more costly and difficult than simply staying those extra few days in the first place. This is often referred to as rehab dumping. But you should know that you have a legal right to appeal a discharge if you believe it is premature. You can request an expedited appeal through your local Quality Improvement Organization, or QIO. You can find yours at medicare.gov. Once you file that appeal,
the hospital cannot legally discharge you while the review is being processed. You are protected. If you feel you are not ready, calmly tell your care team, "I don't feel medically ready for discharge, and I am requesting an expedited appeal through the QIO." This simple, polite, yet firm request has helped many seniors secure the necessary time to reach their recovery baseline. Let's move on to the third trap, which actually begins before you are even admitted. Every hospital pharmacy operates on something called a formulary, which is simply an approved list of medications they choose to stock. The maintenance medications you have been taking for months or even years, your blood pressure medication, heart support, or thyroid pills, might not be on that specific hospital's formulary. Without warning, the hospital might substitute your brand with a generic version or a different chemical equivalent. For those of us over 60, a sudden switch in medication is not just a minor inconvenience. Your cardiovascular system is particularly sensitive to these changes. It can lead to dizziness, fluctuations in blood pressure, or irregular heart rhythms. To protect yourself, always carry an updated written list of every medication you take, including the exact brand name, the dosage, and the timing. When you or a loved one is admitted, hand this list to the admitting doctor or nurse and clearly state, "Do not substitute or alter any of my maintenance medications without an explicit clinical review and my written consent." By saying this, you place the responsibility on the clinical team to flag any potential change to you before it happens, rather than after the fact. This next trap is the one that financially blindsides more seniors than any other. It usually happens in the first 10 minutes of your arrival, when you are likely feeling vulnerable, possibly in pain, and understandably anxious.
Someone will hand you a stack of papers to sign: consent forms, privacy policies, and insurance authorizations. Hidden deep within that paperwork, often in fine print, is a clause that says you assume all financial responsibility for any services not covered by insurance. Most people sign it immediately because they just want to get to their room and start their care. However, that signature can effectively give the hospital the right to bypass standard insurance negotiations and bill you directly at inflated, full rates for anything your plan doesn't cover. This is known as balance billing. Here is your solution. Before you sign any financial agreement, write this exact phrase next to your signature: "Signing only for authorized insurance benefits, not personal financial liability for uncovered balance billing." You can do this in pen right in front of the intake staff. It is completely legal, it clearly documents your intent, and it provides a significant layer of protection against being held personally liable for inflated charges later. Finally, we reach the most significant trap of all, and one that can cost a family tens of thousands of dollars. It is the distinction between being an inpatient and being under observation status. According to government data, a huge number of Medicare patients are placed under observation status each year. While you are lying in a hospital bed, receiving meals and being monitored, you are technically classified as an outpatient. This is critical because Medicare Part A coverage for skilled nursing or rehabilitation after a hospital stay only kicks in after a formal inpatient admission of at least 3 consecutive days. If you are under observation, those days do not count, not even 1 hour of them. I have spoken with many families who returned home, attempted to transition to rehab, and were suddenly hit with a bill for the entire stay because, on paper, Medicare never officially admitted them. If you or a family member is placed in a hospital bed,
Ask the attending physician or case manager directly. Am I admitted as an inpatient, or am I under observation status? If the answer is observation, say this: I am requesting that my status be reviewed for formal inpatient admission based on medical necessity. This creates a documented request that the team must address. Also, ask for your MOON notice, Medicare Outpatient Observation Notice. If you haven't received it within 36 hours, ask for it by name.